everyone. Uh, Hello, hi, assalamualaikum. A very good afternoon, everyone. So, apa khabar semua? Okay, I hope that everyone is doing okay. Okay, welcome again to another episode of Doctors Go Live on Columbia Asia Facebook. So, first of all, my name is Fakri Hamzah, and we will be discussing the topic of anxiety. Okay, very intriguing topic, anxiety, which has affected many teenagers in Malaysia. The world at this stage and life as we know it can be complex and can even be overwhelming for some teenagers. Yeah, so even more overwhelming is their response to inevitable moments such as failure and also rejections. So, but how do we know that this when things are out of control and need professional intervention? So to address this matter, Doctors Go Live, I will be speaking to Dr. Rahidah Abdul Rahim, consultant, child and adolescent psychiatrist from Columbia Asia Hospital, Iskandar Puteri. Hi, Assalamualaikum, Doctor.
Hi, Assalamualaikum. Hi, everyone.
Hi, how are you, Doctor?
So far so good. Okay.
Okay, now we just going to go straight to the topic. Understand me, please. Anxiety in adolescent. But before that, if you have any question, do type in the comment below, and Dr. Rahida will answer your inquiries after her presentation later. Okay, Doctor. So we just proceed to the first question, yeah? Okay, Doctor?
Okay.
Okay, so Doctor, when we speak about adolescent or teenagers, so actually what age are we referring to?
Okay. Okay, Fakri. Okay. I would like to ask the audience if I can speak in both language, Malay and in English, and interchangeably whenever it's suitable. But at any point of time, kalau nak tanya apa-apa, dah start already. Nak tanya apa-apa, you can just write the comment below. Okay, so go back to your question. Sorry. Going back to your question, who are teenagers?
Yes.
Okay, teenagers by WHO are people who age from 10 to 19 years old, and there are stages for this development. Okay, and during this time, there are a lot of physical, social, and sexual development, which is quite overwhelming itself for the adolescent. And at this point in time, they appear like an adult. You know, they have the build like an adult. They are not no longer a children, but they are not yet an adult. So that can be quite difficult for them, in a way, to address this issue. Okay.
Oh, okay. So now we know already what is the exact age for adolescent. So actually, can you describe what exactly is anxiety? Is it the same as being nervous, Doctor?
Okay, actually, the terms anxiety is used interchangeably. Maksudnya, sometimes kita panggil anxiety, sometimes kita panggil fear. Okay, sometimes kita panggil nervous, and actually, anxiety is some form of normal kind of emotion. Okay, it is an emotion that actually has function to guard you, to highlight problems to you, and it is seeking for untuk membantu kita supaya tidak melakukan kesalahan yang kerap. Okay, they look into danger. So actually, it's quite normal to have anxiety. Okay, but overwhelming anxiety can be very, very hard for us even, and also for children and adolescents. And then this thing can affect them in a lot of functions in their life, academic, social. Okay, and usually it starts in childhood. One of the most important disorder that occur in childhood, and it can progress to adulthood. Okay, so this,
okay.
this is the character that I brought up. Okay, this is fear. Fear is one of the character in Inside Out, and like I mentioned, fear's main job is to protect. This is a protective mechanism for us, and it looked for potential disaster. And with anxiety, when we spend time to evaluate a lot of possible dangers, risks, and sort of. So it is a good emotion, not And when it is unbearable or overwhelming or it is chronic, then it become a problem. Yeah. Okay, so this is the Malaysian descriptions of anxiety. We have not much, perkataan yang kita gunakan untuk anxiety ni tak banyak untuk orang Malaysia about this. Maybe kalau Fakri ada perkataan lain yang you use to describe anxiety, you can say it, but usually this is the word that they use. Rasa bimbang, rasa risau, rasa cemas, dan rasa takut. Ada perkataan lain ke Fakri?
Yang perkataan lain, mungkin ini sajalah yang biasanya kita dengar lah.
Mana tahu ada lain. I mean in Kelantan they call it like kenaling, like when I was
kenaling,
in Kelantan. Doktor, saya rasa kenaling. And I was like, apakah itu kenaling?
First time saya dengar tu, doktor.
Yeah. And also in Malaysia, description of used by Chinese, Indian, ada banyak-banyak lah dia punya perkataan yang sometimes I also need to learn all these languages that is associated with anxiety. Yeah.
Okay, so sekarang kita dah kenal lah what is anxiety or kenaling ya. Okay, tapi doktor, based on actual or current statistics, so is anxiety among teenagers common in Malaysia?
It is on a rising, a rising trend whereby I think me and my friends, and not only in psychiatry tapi dalam public health, kesihatan awam, they find that they have been seeing more students that come out with anxiety compared to years before. Okay. And currently we did this survey, it's not currently lah, it's in 2007, they go and search 30,000 children and adolescents, and then they come up with national health and mobility survey lah. So this is done in Malaysia and released in 2018. And in this survey, they found that this is the current state of adolescent health in Malaysia. Okay, so one of them is depressed, 2 is anxious, and 1 in 10 is stressed. The 2 in 5 is anxious. So dalam 10 orang, 4 orang akan anxious lah. Okay, but this survey only says that anxious lah. Dia tak kata anxiety disorder ke apa ke tidak. Dia just mengatakan bahawa kita punya adolescent sekarang ni berada dalam state yang sentiasa berwaspada, sentiasa berjaga-jaga, sentiasa dalam takut lah. Sebab 2 in 5 are having anxiousness.
So memang sekarang ni kita yang untuk trend sekarang ni mereka akan takut untuk masa depan atau yang ke belakangnya ya. Yeah. So is there any different macam perbezaan lah types of anxiety disorder tu, doktor? So among child and teenagers.
Okay, let's see. Okay, so this is the normal anxiety. This is what you and I are having before we start off this conversation.
Oh, yeah.
Yeah, we did a little bit of this, and I figured that everyone who came to this room just now have this like some anxiety, and even over the other side on the HQ pun ada sikit anxiety. Okay, why we need this? Actually, because anxiety is normal. It creates this, kita nampak risiko, kita nampak boleh berjaya ke, boleh gagal ke kan, and kita berusaha untuk menjayakan sesuatu kan. So you see, this is anxiety and this is the performance. So when the anxiety is just right, your performance is the optimum. Okay, but if you have anxiety yang berterusan, yang melebihi daripada kemampuan kita untuk perform, then kita dapati a lot of us will perform poorly with anxiety. So you just need that little bit for you to be just on the right track so that you can perform. Okay, alright. And then there are, okay, so you can see untuk age of onset of major mental disorders. Okay, this is what we call disorders. These are not just normal anxiety. These are anxieties yang debilitating. Yang mana anxiety ni menyebabkan kita tak boleh buat banyak benda. Like you cannot function as who you are, as anak, as student, whoever you are lah kan. You can't function properly. You're not taking care of yourself. So this kind of mental disorders, you can see that anxiety disorders they occur more in a big age range. Okay, and most of it akan start off usually during this teenage or childhood lah, and it progresses to adult. So kalau you dapat kenal pasti awal, then the progression is less. Kalau you tak kenal pasti, we can grow with it because Anxiety disorder is something yang kita akan cuba juga untuk cope. Cuba cope, sometimes it's not able to cope anymore. Okay, then would you like to know the types of anxiety?
Yes, that I mentioned earlier lah. The type, maybe there are several types, right?
There are several types. Okay, the types of anxiety ni ada banyak. Basically sama je macam the types of anxiety in adult. Okay, so ada banyak lah. Ada banyak. Bila jumpa saya tu, bila jumpa one of my colleagues, we try to figure out apakah masalah yang sebenarnya. So one of it is what we call generalized anxiety disorder. Ini jenis orang yang worry-wise. Semua benda dia risau. So many things you're worried about. Like, I'm worried about my dad, is he coming home? I'm worried about my mom, is he going to get better? I'm worried about my academic or masalah perbelanjaan keluarga. So they generally, kita panggil worry watch. You just worry about everything, you know. There's no specific theme ataupun reason for you to, you know, be worried. Just worry about everything. Then kebanyakan those yang ada generalized anxiety disorder ni dia ada banyak macam, because you're so worried, you're gonna have like sakit sini. So ada banyak simptom lain lah. Okay. Then next, we have obsessive compulsive disorder. Fakri pernah dengar ke ni?
Okay, pernah juga dulu. Kita dengar.
Okay. So this OCD je kalau orang yang very particular kan, very macam sangat clean, sangat teratur je kita panggil dia OCD. Okay. OCD person. But then that's not all about it. People who have obsessions are people yang ada fikiran tu, dia tak boleh kawal fikiran tu masuk. Contohnya macam saya perlu untuk susun buku ini dengan teratur kerana jika tidak sesuatu akan berlaku. Okay. So walaupun saya tak nak susun ni,
kita boleh bagi tahu ianya adalah juga sama macam seorang yang sukakan kesempurnaan ke doktor?
Yes. Obsessive compulsive disorder ni dia bukan suka. Sebenarnya you suka, you gembira nak buat. Tapi bila obsessive compulsive disorder is like dia terpaksa untuk susun buku tu sebab kalau dia tak susun buku tu dengan betul, sesuatu yang akan berlaku. Jadi dia rasa stres. So dia akan kena susun juga. It's different from suka. Selalunya orang obsessive compulsive ni dia tak suka. Dia tak suka dengan fikiran yang ulang-ulang, perbuatan yang ulang-ulang. So dia tak suka. That's why they come to us. Kalau dia suka dia tak datang, Fakri.
Betul.
Sebab dia tak suka. Okay, alright. Then the other one is social anxiety. Social anxiety are people that have problem with anything that is social lah. Contohnya macam nak buat presentation, nak jumpa orang, because dia takut yang orang akan tengok dia bodoh, you know, they can't do it, judging, and stuff like that. Okay, so this is quite common in adolescents sebab masa ni yang social needs are very high. You know, you have to siapa yang paling handsome, siapa yang paling cool, so they have to bring up themselves. Okay, and then the other one is separation anxiety, which is actually in the younger group. Maksudnya dia memang takut sesuatu yang buruk akan berlaku kepada orang yang penjaga dia. Contoh bapak dia ke mak dia. So they are kind of like clingy, you know, like they want them to always be around. Pergi sekolah susah sebab nak tengok mak dengan ayah tu depan mata. Alright, and then the other one is PTSD, which is kita selalu dengar. Okay, I break dengan boyfriend lah, I trauma lah kan. It's something like that.
Ini biasa berlaku di zaman sekolah ni.
Macam trauma kan. Tapi the word that is very important here is the perkataan traumatic. Traumatic ni perkataan dia ialah something that happen yang boleh menyebabkan you mati ataupun seseorang itu mati. You know that it can cause death or severe injury. Okay. Mungkin kalau kita broke up tu mati macam mana? Mati hati lah kan. But that's not the term that we use for PTSD lah. Okay. And then PTSD ni dia banyak recurrent thoughts about the trauma itself. You know, you cannot talk about it, you cannot go through it. So banyak benda yang terhalang lah. Contoh kalau you ada accident dekat jalan A. So jalan A tu you have to avoid. Walaupun jalan A tu je lah satu-satu you nak pergi kerja or pergi sekolah. So we have to avoid. Okay, tu dia PTSD. Then the other one is phobia. Pernah dengar tak phobia?
Ya, kita pernah dengar lah. Phobia dalam bermacam benda dah. Ada phobia takut.
Takut apa? Fakri, you ada phobia?
Saya ada phobia juga doktor. Saya fobia dekat tempat yang sempit. Saya kurang pasti
tempat sempit tu rasa tak selamat kan bila
saya rasa tak sama.
Yeah. So apa yang you ialah phobia people who lot of anxiety, kita akan cuba avoid kan. Kan kita kalau kita masuk dekat kawasan kita fobia atau nampak benda yang kita fobia tu, kita selalu kira benda yang buruk akan berlaku pada kita. Okay, contoh lipas lah. Katanya apa yang lipas boleh buat pada kita? This is just tiny little thing, you know. It works when it comes flying kan. Tapi kita rasa lipas tu boleh sebabkan kita dia geli, kotor macam tu kan. So a lot of people will be phobia of certain of the insects lah. Disebabkan oleh apa yang kita fikir. Kita macam cognition kita tu berkenaan dengan lipas ke binatang tu dan menyebabkan kita fikir yang sangat-sangat catastrophic. Yang sangat-sangat buruk. Tentu, okay? Macam kalau Fakri masuk lift, agaknya Fakri rasa lift tu akan jatuh.
Betul.
Ataupun blackout and then you have no oxygen, things like that. Okay, so you come up with the worst outcome there is. Okay, and then the next one is selective mutism. Ini bila dekat rumah cakap banyak, dekat sekolah tak bercakap langsung, jumpa doktor tak bercakap langsung. Okay, because of fear, selalunya disebabkan oleh fear lah. Contohnya macam dia gagap contohnya. Lepas tu setiap kali cakap je orang marah, orang tegur kan. Jadi bila nak cakap tu dia pilih-pilih tempat lah. So orang kata kat rumah bercakap, kat sekolah semua tak bercakap. Bila ada masalah ni terganggulah pelajaran dia. Okay, so macam tu. These are the types of anxiety disorder yang ada lah. Yes, ada apa soalan lagi?
Dan so sekarang ni kita dah tahulah ada beberapa type of anxiety disorders kan. So actually maybe there are symptoms mungkin yang perlu kita kenal pasti dan how we can diagnose anxiety in teenagers.
Okay, right. Oh, that's another one.
Ada
sorry. Panic. But panic ini usually the age of onset is in a teenager yang hujung-hujung macam 19, 20, 21, 22. Okay. Jarang-jarang sekali lagi, bukan jarang-jarang lah. Saya sebenarnya jarang diagnose disorder in children and adolescent. Tapi ada. Okay. Now back to your symptoms. Right, sorry. Dia dalam for anxiety, just to let you know, when you're a girl, unfortunately, you have more risk of getting anxiety disorder. Okay. Alright. So these are the age of onset. Just to recap balik kan. You see, kebanyakan anxiety yang saya sebut ni dia berumur dia start daripada umur yang young. So kalau macam fobia dia start daripada umur yang kecil 6 to 7. Okay. Then social anxiety 11 to 13, then OCD 13 to 15. Okay. And GAD ni risau banyak benda tu lah. Okay. 10, 12. And separation anxiety whereby your parents not being there. Okay. 7 to 8. Panic disorder later on. Right. Okay. Just to mention a little bit about comorbidity sebelum kita masuk kepada symptom. Okay, I'm going to go through this like very fast just to say that anxiety ni dia overlap dengan banyak benda lain, banyak penyakit lain. So when you have anxiety, kalau macam tadi saya sebut satu GAD tu apa, OCD tu apa, tapi sebenarnya anxiety tends to overlap with itself. That's why kadang-kadang kita tak boleh nak diagnose GAD ke, anxiety je ke, OCD je ke. So most of the time in adolescent, dia akan lump diagnosis like anxiety disorder. Okay? Right. And it is usually overlap juga dengan depression. So prolonged anxiety, you can cope. There's a lot of fear. Feeling like you cannot go to the bed, go nowhere. Depression is gonna set in. Okay. And a lot of younger children have anxiety will come up with behavioral issues. So bila kecil-kecil dia tak akan cakap saya anxious. Ibu, saya anxious ibu. Which you don't name. Tapi usually they will come up with problem, behavioral problem. Macam kenapa anak saya ni suka beresah, gelisah, menjerit, benda macam itu. So
dia duduk kat sudut tu.
Tapi dia tak duduk sudut. Selalunya anxious ni dia banyak tenaga. Dia suka anxiety cause you to be restless kan. Ke hulu, ke hilir, ke hulu, ke depan, ke belakang. You be a bit
Dia tak
restless.
senang duduk lah, senang cerita.
Oh yes, macam orang kata cacing kepanasan.
Cacing kepanasan, yeah. Yes, the word lah.
That's the word. Okay. So usually in younger kids they present macam tu lah, mengeletih sana mengeletih sini mak kata. Okay. In older kids they be able to say that they're worried, they have fear and things like that. Younger kids no. So perkataan dia kurang kan. I know I haven't heard kids say, usually they will say stress but they will never say I'm anxious or younger kids lah 6 tahun 7 tahun they won't say something like that. Maybe they use the word fear. Okay. Right. Okay, and for older kids, bila dia tak boleh cope dengan rasa resah gelisah tu, they tend to use substance. Substance ni maksudnya alkohol ke, dadah ke, you know, just to calm themselves down. Kita panggil self-medicating themselves lah, self-medication. Okay, gunakan dadah tu untuk mengurangkan simptom-simptom keresahan. Okay, so now we are here. Okay, about the symptoms and diagnosis. Yes. Okay, so the main features of anxiety is basically you want to avoid. I mean, all of us, if we have anxiety, kita nak avoid. Contohnya, I'm worried about making mistakes when I talk, or I feel like being judged, so I avoid talking to people or avoid making presentations. Okay, and then you can also you feel shy. Oh no lah, you go lah, never mind lah. You lah pergi, I tak nak. Tak apa, you pergi. You know, those pushing kan. That's factor of threat. Maksudnya, very worried, there's a lot of rumination, okay? Anxious, anticipation, and negative thoughts. Okay? Okay, so these are some of the symptoms that is a part of the anxiety symptoms.
Okay, so these are the symptoms lah. So and how we can diagnose. Okay, so
yes, Fakri.
So now we know the symptoms and how we can diagnose. So, but what will happen? Apa akan jadi kalau anxiety ni kita left it untreated, doktor? So what it may lead to?
Okay.
Kesannya.
Yeah. Okay. So, I'm gonna go a little bit more on the symptoms just to highlight to you what are the symptoms. And anxiety ni dia bukan satu symptom saja. There are physical symptom. Physical adalah badan lah. Okay, kalau misalnya kita risau, resah, gelisah. Fakri, apa benda yang berlaku kepada badan awak kalau awak gelisah? Awak fear.
Saya perlu banyak, doktor.
Perlu lagi apa? Berdebar-debar lagi apa? Kan? So badan kita bagi tahu banyak signal. Okay. And cognitive symptoms ni is when you have doubts, you know, what if the line is not good? What if this not? What if, you know, I say something stupid? What if? There's so many what ifs. Okay, emotional symptom ni macam you jadi macam tak keruan lah. Tak keluar rasa macam sedih, takut, okay. Then behavior symptoms, I think I mentioned yang the pacing around, the avoidance. Okay, so these are the symptoms. Okay, let's see if we can go a bit fast. Okay, this is just to recap what we have said. Okay, so some have muscle tension, some have dizziness, stomach ache and whatnot lah. Okay, and in children and adolescents banyak physical symptoms sebab they cannot say, so everything they feel. And cognitive symptom is what if, and emotional symptoms is the frustration, anger, disappointment, and then there's behavior lah, avoidance and whatnot. Okay, alright. So these are, you know, I had this few minutes before we start. I don't know about you, Fatih. Jelly kan? Yes, jelly shivering, tak adalah shiver macam sikit lah. Jelly ni, jelly legs, jelly like, you know. You meet someone you like and you feel jelly. That's what they said lah. Okay. Right. Okay. I'm gonna breeze through this because we have talked about it just now. Okay.
That's correct.
Alright. Okay. So basically you akan appear as fight and flight. Okay. Either you are ready to fight or you're ready to run lah. You can actually the parents can say that, you know, whether she's like cakap sikit mengamuk means like they are ready to fight. If flight means dia tegur je, they will shy away or they run away. So these are the symptoms that parents usually can tell me. Okay, alright. So they presented in so many ways. Okay, I hope when we see apa kita tengok semula slide-slide ni kan, sebab dia akan present dengan banyak-banyak cara, sometimes dengan cara yang pelik-pelik lah. Okay, antara yang banyak datang dekat saya yang kita kena work out are things like stomach ache, headaches, you know. They don't really come up with anxiety. Okay. Okay. Then what if left untreated? So the impact of anxiety on students as such, I mean, it's clear that it can cause poor academic outcomes, school dropouts, problems in relationship, suicidality, okay? Rasa nak mati, nak bunuh diri. And it progresses to difficulties in adult life. And if they drop out from school, about 46% of them will have mental illness later on. So sekarang ni kita nak kena lawan school refusal behavior yang disebabkan oleh anxiety. Right. Okay.
Okay.
Then would you like to know the main factors that lead to this?
Yes, because maybe there are many factors. Is it because of family, friends, or relationship, Doctor?
I mean for adolescent banyak-banyak faktor. Sebab apa? Semua yang mereka tak tangani, tak boleh nak cope, they will have anxiety. Okay. So I'm just gonna go breeze through sebenarnya, okay. Like risk and maintaining factors ni, okay. Anxiety runs in the family. Maksudnya kalau bapa kita ada anxiety, kita pun likely to have anxiety. But this doesn't mean that
turun lah.
Turun-temurun. I mean, diabetes turun-temurun, hypertension turun-temurun.
Same goes to anxiety lah.
Same goes to anxiety. You can't say that, oh, it's because of my father I have anxiety. No. It's like, ada je orang yang ada family history of anxiety, they don't have anxiety. Okay. But what good about having known to us about family history is that kita akan lebih vigilant, okay, nak lihat how you cope so that the problem tak progress. Tak progress kepada perkara yang lebih teruk lah. Okay. Of course, parenting is an issue bila melibatkan kanak-kanak dan remaja. Okay, so some characteristic of parenting yang will lead into this is, one is overprotection. Family yang selalu protect anak, tak boleh buat ni, tak boleh buat tu, semua salah. Jadi anak takut nak buat salah. Okay. Inclusive pula, semua benda tak boleh. Semua benda salah. Okay. And a lot of negative in the family. Ada komen, semua boleh buat, tapi ada komen-komen negatif yang selalu timbul. Okay. So in the family, these are some of the risk and maintaining factor.
Kurang dapat sokongan lah.
And more like, okay, 1/3 of our adolescent in Malaysia says their family tak faham. So I think the last year, I don't get like anxiety, depression punya complaint, but I get, what's your problem? My problem is my parents don't understand me. So it's like, it's another symptom lah sebenarnya. My family didn't understand me. Okay, then yang berkaitan dengan anak tu sendiri is, you know, when there's negative events in life, parents bercerai, somebody die, okay, and then bullying, and then neglect, and also chronic illness. So pesakit yang ada chronic illness also tend to have a lot of anxiety because dia tak tahu dia orang boleh cope dengan sekolah tu atau life, ataupun just because they cannot cope with the penyakit tu sendiri. Okay. Okay, and then this one is satu lagi, sometimes it's not your family, sometimes it's not the surrounding, but the way you think about you, the way you think about the things that happened around us. Okay, so bila kita selalu sangat merasa bahawa kita ni berada dalam keadaan yang threatening, ini tak boleh, itu tak boleh, takut, ini jadi macam ni, what if kalau kan, right? And then kita hanya nampak benda-benda yang positif susah nak nampak, tapi nampak benda yang negatif dan nampak benda yang boleh menyusahkan.
Can I say it's negative thinking?
Negative thinking is one, you akan nampak benda tu macam, okay, what if dia tu, kan, okay, kita nampak benda ni boleh berjaya, okay, boleh buat, maybe 70% boleh berjaya, tapi Yang 1% tu yang kita nak tengok. If it fails, you know, what happened to me if it fails? Okay. And then when we see a lot of threat belief, attention to threats, and then interpret threats wrongly, you know, berlaku kat kita sekali tapi macam seluruh hidup kita akan mengalami masalah tersebut. Contoh, you masuk lift, hari tu lah lift tu lampu tak ada. Tapi apabila pun saya takkan naik lift, you kata, sebab nanti kalau lampu tak ada macam mana? Okay. The threat only happen once, but you misinterpret into so many other things. Okay, so this is the lastly is this one. Sometimes you take alcohol. Sekarang ni sebenarnya untuk pengetahuan lah the number of kanak-kanak dan remaja yang mengambil substance ataupun gunakan dadah ni sebenarnya as early as 7 years old. 7 years old. Okay, and sometimes withdrawal means kalau kita contohlah kita bagi caffeine. Kita hari-hari minum kopi, anak ada budak-budak esok minum kopi. Lepas tu satu hari tu dia tak dapat kopi, jadi anxious. Tu simple lah. So maksudnya withdrawal ni bila sesuatu tu kita dah selalu guna dan kita tak dapat, kita pun boleh mendapat symptom of anxiety. Okay.
Okay, faham. Okay, kita ke soalan seterusnya. Okay, apakah daripada medical perspective, apakah reason that has made life more complex for teenagers today compared to 10-15 years back? Betul?
Ya. I mean, sekarang ni kita ni dalam kategori kita panggil kita anak-anak remaja kita as digital natives. I mean, we are the 4th largest digital native in the world.
Zaman TikTok.
Zaman benda pun dekat hujung jari, semua benda pun kita boleh access. So ada banyak ledakan maklumat lah. Okay, and I tell you, the parents they're very smart, you know, they can ask you a lot of things and they're quite berani jugalah. Okay, so one is this mobile kind of thing. Okay, lepas tu diorang akan anxious dalam keadaan macam mana? How much do I tell people and how much do I keep to myself? So isu-isu privacy kan. So benda-benda yang kalau kita nak orang suka kita kena beritahu semua benda. So they have these thoughts lah. Okay. And then social, of course social. Dalam kita punya recent study NMHS 2019, kita dapati bahawa peer pressure is one of the highest cause for mental health issues in adolescent. Okay, so kawan-kawan lah, kawan buat apa, kawan nak apa, kita nak lawan dengan benda tu. And this is also closely related with digital punya digital world. Okay? Dan satu lagi akademik. Bila semangat tu memang semangat yang tinggi, requirement is very high, you kena compete. So the competition is quite high, kan? Tengok kerja banyak-banyak kerja pun competition is very high to get good job. Okay? Dan family of course siapa lagi yang nak beri stress kat kita kalau bukan family.
Betul.
Yes, I mean because we are different people with different thinking, different values. Bila ada discrepancy antara apa yang orang nak dan apa yang kita boleh dapat, itu pun boleh menyebabkan anxiety.
Okay. So now we know that anxiety is giving trouble actually, right? So when should parents start getting worried about their teenagers' anxiety? This is the main question that you need to
okay. So when do you actually worry about the warrior? Okay. Bila kita risau pasal orang-orang yang suka risau ni. Okay, so the red flag that we have to look into is kalau anak-anak dan remaja ni kita tengok ada deterioration in their academic performance. Gradual, maksudnya pelan-pelan. Dulu orang kata darjah 5, darjah 6 okey doktor, sekarang makin teruk. Okay, deterioration in overall functioning. Maksudnya dulu suka keluar, sekarang tak suka keluar. Dulu boleh mandi, boleh pakai sendiri. Sekarang semua tu dah macam tak nak jaga diri. Dulu handsome, sado, sekarang macam whatever. Macam tu. Okay? So you nampak the overall functioning is deteriorating. On the edge ni maksudnya sikit-sikit nak marah, sikit-sikit nak sentap. The usual word they use is, my child is very sensitive. Orang sensitif, orang yang macam snappy. Okay. Then the next one, self-harming lah. Kalau ada self-harming, please refer. Okay. We need to assess how far can they go with their self-harming. Self-harming can be many things. Bentuk kepala kat dinding. The other one is cutting pakai blade ke, pakai scissors ke, sharpener punya blade ke. Okay. Depression, of course, depression is already if there's a diagnosis, you tak nak keluar, you tak nak makan, tak nak minum, okay, itu memang red flags lah. And then unexplained physical symptoms. Unexplained physical symptoms means, kalau kita ada palpitation tadi kan, palpitation ni kita tak tahu sama ada is a heart problem or it's just anxiety. Okay? Kalau kita ada stomach ache, is something wrong with our stomach or is this anxiety? So kalau ada physical symptoms ni, kita tak tahu apa sebab dia, itu kena dapat perhatian doktor. You don't go like, oh you sakit perut ke, must be anxiety. Oh you sakit dada ke, must be anxiety. Tak boleh lah.
So need to check first lah. Kita kena berjumpa dengan yang pakar dulu lah. Okay, saya rasa ada lagi satu tu doktor. Sensitif
Kenapa dengan sensitif? Oh sensitif ke?
One of the red flag lah.
Yes. Red flag, yes. On the edge.
Apa yang dimasukkan dengan sensitif di sini doktor?
Apa dia?
Apa yang dimasukkan dengan sensitif di sini?
Sensitif tu yang macam orang yang kita tak boleh tegur. Selalu orang cakap, tegur sikit je nak mengamuk.
So ini adalah perubahan yang ketara lah. Mungkin sebelum ni dia adalah okay dan sekarang dah masuk satu fasa baru, tiba-tiba dia terlebih sensitif pula. Adakah begitu doktor?
Yes, dia kena ada perubahan daripada yang dulu. Yang tu yang bukan yang dulu dan sekarang tu ada perbezaan lah.
Okay, understand. So we move to the another question, doctor. Okay.
Yes.
Dalam what stage should we seek medical advice?
Okay. Oh yeah, sensitive. Sorry. Alright. Yeah. Okay. Sorry. I kind of like click that. Okay. When do we seek medical help? Okay. When to seek medical help? When kebanyakan kita bila kita stress ataupun anxiety tu, kita akan ada kita punya own self help strategies. Contohnya macam I go and drink coffee, I talk to my superior, I meet my friends. Okay. So budak-budak ni mungkin dia boleh main bola ke apa, tapi they find out that do that is not helpful. Okay. And then the anxiety is causing a lot of distress and disturbance in whatever they do. Tak boleh jadi semuanya takut kan. Okay. And then there are significant physical symptoms. Must rule out that medical conditions. Okay. Becoming aggressive. When they are snappy, they tend to be more irritable, can be more aggressive. Okay. When they are depressed or suicidal, so they can express actually rasa nak mati, nak bunuh diri. Sometimes the anxiety is too overwhelming that they feel that they cannot cope and then they just want to end their life. Right? And then presence of psychotic experience. So what is psychotic experience? Sometimes when you have a lot of anxiety, you start to feel different about yourself or different about environment, whereby you may have boleh dengar bunyi-bunyi kat telinga atau start nampak bayang-bayang yang tak ada kat situ sebenarnya. Okay, so this is what we call psychotic experience.
Okay, understand. Okay, so maybe doctor, you have some tips for the teenagers who have this anxiety disorder. Maybe tips to make them to relax lah.
Okay, so I mean you're talking about treatment, right? Of course,
yes,
when I diagnose, definitely we have to plan. First kita nak tahu anxiety yang macam mana, then kita nak tahu apakah rawatan yang boleh membantu lah. Okay. So usually kita tanya dulu apa benda yang boleh membantu dia. So there are a few things that usually they come up with, like distraction, relaxation, problem solving, connecting with other people, managing stress and leading a healthy lifestyle lah. Makan, tidur semua okay. So firstly kita akan go along this line dulu and see how good they are in their self-help punya techniques. Okay. Okay, mindfulness is another form of a new thing yang sebenarnya kita gunakan supaya kita jadi fokus kita tu kepada what is now, what not past atau future, basically connecting to the now. Okay, this is an idea that is quite useful in recent days. Okay. And then
Okay. So
Yes,
maybe there are some treatments available as of today, Doktor, kita mengatasi masalah ini.
Okay, seboleh-bolehnya bagi kanak-kanak dan remaja is to work on diorang punya foundation. Foundation maksudnya bagaimana diorang selesaikan masalah. The self-help tu kita akan drill again and again sebab masa akan datang pun anxiety tu boleh timbul semula. Jadi kita akan bagi diorang skill yang secukupnya lah. Okay, so treatments of course available in terms of medical treatment. So one of the thing that kita selalu guna ialah SSRI. SSRI ni ialah sejenis antidepressant. Okay, so bila kita buat diagnosis anxiety disorder, usually we will start SSRIs ni lah. Okay. Then the next one is all the skill based. So maksudnya kalau kita buat relaxation tadi tu, you buat betul ke tidak? Okay. Kalau you what if tu, kita nak cuba betulkan fikiran you. Okay, and definitely parent training is also very, very important so that parents also learn how to manage their own anxiety and also the patient. Sebab selalunya anak-anak ni akan tengok macam mana ibu bapa dia tangani masalah. Okay, so they learn through what they see lah.
Okay, faham. So, Doctor, maybe can you describe an ideal environment for teenagers that will help them to develop positive traits?
Okay, so maksudnya we have to prepare our family and adolescents so that they can overcome challenges better in their life, right? Okay, so these are the things that the parents should know, parents should know. So as parents and adults, we are the provider. So you see, this is what we call Maslow hierarchy of need. Okay, and a lot of parents dia akan minta kita, contohnya anak tu macam mana tak anxious, how to make good problem solving. But you have to see that morality, creativity, problem solving, all is on the top of the pyramid. Okay, so sekiranya timbul masalah-masalah yang berkaitan dengan this thing, self-actualization, yang bawah ni perlu ada disediakan terlebih dahulu. Okay, physiological means preparation in terms of basic needs. Okay,
basic needs,
yes, makan, tidur and whatnot lah. And then safety maksudnya rumah. I have a patient yang ada rumah tapi tak ada pintu, tak ada tingkap. So of course lah banyak anxiety kan berkenaan dengan keselamatan. Okay, love and belonging, which is family, relationship, and then esteem, which is confidence and self. So untuk dapatkan environment yang positif, okay, these needs has to be looked into. Okay, and then some other things that I think is also important is love. You tak ada boundaries to love. Sometimes kita say, I love you if you help me with that. Or I love you if you got 10 A's. Or I love you if. So actually love.
So ada syarat pula.
Apa dia?
Ada syarat pula love tu, ya?
Apa dia? Sorry. Apa dia?
Ada condition pula love tu.
Yes, condition. Love, makan, minum, you tak boleh letak condition. Okay, makan, minum, love, you have to give. Okay, and the other one is that when we as parents, kita kena dengar tu, open communication tu, we have to listen and we cannot judge. Sebab selama ni kalau kita as parents and adults, bila kita dengar tu kita nak apa, sebenarnya kita nak bagi pendapat, nak betulkan, nak bagi arahan, kan? So we feel like we need to correct it, but actually some kids they just want us to listen to their problems. Okay? And then we have to make room for mistakes, because if they don't make mistakes, they will not learn how to help themselves. Okay? And then next is about giving pujian atau praises. Okay? So usually we praise the process. Praising the process means kita memberi pujian kepada kata kerja. Faham tak Fakir? Maksudnya kata kerja. Contohnya macam kata kerja ni macam, okay, kita tak kata Tanya, baguslah anak ibu dapat nombor 1. Nombor 1 is the outcome. Tapi kalau kita nak kelakuan yang baik berulang-ulang, kita kena cakap, wah bagusnya anak ibu hari ni rajin belajar. Wah anak ibu hari ni pandai melukis. So menggunakan kata kerja, bukannya outcome. Okay. Bila anak-anak ni lihat dia tak dapat outcome, contohnya macam tak dapat nombor 1, tak boleh buat, takkan dapat A, di situlah ada anxiety sebab dia tak akan dapat capai the outcome. That's why we must praise on the process but not really the outcome. Okay?
So kita kena puji on what they are doing. So instead of the result.
Yeah. Right? Sebab kita nak kelakuan tu yang baik tu berulang. Okay? Next is, for adolescent, we have to be the consultant. What does it mean by consultant? I mean, kita ramai consultant kan? Okay, so yes, masa budak-budak ni kecil, kita jadi manager. Manager tu apa? Maksudnya kita suruh dia buat tu. Okay, you pergi kelas ni, waktu ni, apa benda semua kan? Okay, tapi bila consultant ni masuk adolescent atau kanak-kanak dan remaja ni, dia akan datang kat kita bila ada masalah sahaja. Maksudnya kalau dia datang kepada kita bertanya soalan ketika dia remaja, maksudnya dia percayakan kita untuk bantu dia dalam penyelesaian masalah. Okay? Dan kita perlu jadi the role model, definitely cara kita menyelesaikan masalah akan, dia orang akan sometimes tiru cara kita tu. Okay? And then in lots of family with a lot of medical problems ataupun psychiatric problem, we need a family who do not give up on these kids. Okay, Puteri?
Okay. So sekarang kita dah faham lah. This is all the tips for parents to actually how we can overcome this anxiety. Okay. So thanks Dr. Rahidah for the wonderful sharing. So as I can see here, okay, some Bajish Paul dia bagi thumbs up dekat doktor. Okay, and we have a few questions, doktor. From Emily Emis. How about people who's having anxiety disorder?
Yeah, what was the question? I mean, we want to know about apa tu? How about
maybe she wants to know the symptoms, I think.
Oh, okay. The symptoms is
symptoms in details.
Okay. I mean, what the symptoms I've mentioned just now is the physical symptoms, the emotional symptoms, the cognitive symptoms, all those what ifs, kan? It can be normal, but when I say it is a disorder, bila fungsi-fungsi harian ataupun daily function is affected. Contohnya macam you have OCD and then you need to mandi for about probably 1 hour every day. So how to go to work, how to go to school. Okay, so people who have disorder, kebanyakan dia punya aktiviti harian akan terganggu lah. Aktiviti harian termasuk relationships, kerja, and then penjagaan diri. So a lot of OCD people also have this problem bila dia macam mandi terlalu lama, dia decide dia tak nak mandi. Sebab kalau dia mandi lama, contohnya macam tu. So there's impairment yang ketara untuk people that have anxiety disorders.
Okay, faham. Okay, dan soalan seterusnya, question from Ms. Muhammad Firdaus Ismail. What is differences between anxiety and stress? Is there any difference, Doctor?
We usually use interchangeably, but when I look for stress and anxiety means a lot of physical symptoms. Okay, kita cari stress ni macam apa yang dalam fikiran kita, macam otak kita macam kita serabut, kita rasa overwhelmed. Okay, kita tak guna perkataan anxiety. Kalau overwhelmed, banyak sangat benda yang kita fikir kan, kita panggil itu stress. Tapi anxiety ni kita rasa macam there's a lot of fear, there's a lot of avoidance. Tapi in Malaysia, these terms are being used interchangeably. Okay, and stress too is not a diagnosis, anxiety itself is not a diagnosis. But when you have this complaint, I will look for probable diagnosis that we need to treat. Some of this anxiety or stress, you just need people to talk to, the usual, minum kopi, lepak-lepak, would help. but real anxiety disorders will need treatment.
Okay, understand. And we got also question from Pre-K Sandu. This is one of your slide lah, doctor. Why is anxiety more common in females than males? So is females complicated, doctor?
Yeah, unfortunately, females are more, I mean, males probably the characteristic of the gender itself lah. Okay, kalau males they just do, they problem solve. They figured that they will more they show a lot of more behavior kind of thing, acting out and stuff. We don't call it anxiety. Tapi female ni bila dia fikir dan fikir. So, we tend to think more than males. Yeah, I mean, unfortunately lah. But that, I mean, just to make it balance, ada je masalah kesihatan lain yang banyak kat lelaki. Tapi kita dapat yang ni lah, anxiety disorders.
Okay, understand. Okay, so we move to the next question. Okay, from Nofi Arif. So she said that my 16 years old daughter diagnosed with BMD level 1. So now I'm having difficulties to focus, keep on overthink sampai sakit kepala. So risau jadi pelajar paling tak pandai dalam kelas. How at least to minimize the things inside her head. So this is very you need to address that.
Okay, so you see, anxiety ni ialah selalunya bila kita merasakan bahawa kebolehan kita untuk mencapai sesuatu tu tak cukup. Masalah dia adalah sebenarnya tak boleh fokus dan mungkin dia subjek tu dia tak boleh nak lepas ataupun nak. Tapi bila dia fikir, contohnya I will fail, I will make mistakes, I will look stupid, okay? Actually just by thinking, dia akan activate anxiety. And as parents, we would like to ask, kita tanya balik pelajar tu, anak tu, okay, let's focus on the problem. What are the problem, apa yang kita boleh selesaikan. So just focus on the problem rather than thinking.
So focus directly to the problem, okay?
Ya. Sebab kita memang ada masalah tu. Sebenarnya anxiety ni dia dalam otak. Fikir and it will grow. Masalah tu mungkin not so big lah and we can deal with it.
So actually dia fikir without finding a solution. So dia akan gitu ke doktor? Okay. So we go to the last question, doctor, from Hasrina Ismail. How do we identify and address anxiety issues happen to teens staying away from home residential school?
Okay. All right. So I mean, the awareness is very, very important. Okay. I mean, I think there's a lot of working together with the school teachers, the parent-teacher support, parent-teachers group, in dalam kita memberikan awareness. Awareness tu penting. Kalau kita tak ada awareness, cikgu ke, ibu bapa ke pun sebenarnya tak nampak benda ni. Tapi awareness tu ialah sebenarnya bukan kepada cikgu dan ibu bapa saja, tetapi kepada semua mereka yang menjaga dan ada kerjasama dengan kanak-kanak dan remaja. So basically, satu, you kena bagi tahu awareness. Kedua ialah kita boleh buat screening. Jadi kalau nak tahu screening tu, can communicate with me directly because we do have screening tools that we can use to identify at least how they are. Macam kita guna MHMS 2017 tu, screening tools tu kita pun boleh guna juga untuk di residential schools.
Okay, faham. Okay, I think that's all the time that we have today. Okay. One more question. From Sakinah Aljunid. Okay, what advice can you give parents who find it very challenging to handle their teenager with anxiety?
Yeah, I mean, this is a very common question. Sometimes when I see children or adolescent with anxiety, sesi untuk anak mungkin 1 kali, sesi untuk ibu bapa mungkin 2 kali. So instead of talking to the child, I talk also to the parents. I mean sometimes this is about parenting lah, okay. Parenting tak ada benda yang orang kata terlalu betul, terlalu salah. No, actually parenting ni kita kena fikir what is nice or what is enough for your kids. Okay, sometimes parents ni kita ada expectation juga. So kita kena assess kita punya expectation. Tinggi mana expectation kita tu, anak kita tu dekat mana. So, bila kita sedar adanya perbezaan ini, okay, then come back to open communication. Kita must be able to communicate secara berkesanan dengan anak tu. It start off with that. Okay, sebenarnya kalau kita nak cerita parenting advice, there will be another session. It's a very lengthy session sebab that is where I put a lot of focus on.
Okay, understand. So I think that's all for today. That's all the time that we have today. So thank you so much, Dr. Rahidah, for your wonderful sharing on the topic of the topic of understand me please and anxiety in adolescence. So and again, I would like to thanks to all the viewers for joining us today, and we hope that we can adakan satu lagi sesi with Dr. Rahidah for another topic maybe. And Dr.
Okay, no problem.
Maybe another topic. Okay.
Boleh.
So that's all from me. Okay. Assalamualaikum and bye-bye.
Assalamualaikum. Bye everyone.